Countless counties across central New York are working hard to get everybody vaccinated and put an end to the coronavirus.
Yeah, they sure are. Tompkins County, one of them. They've been doing an incredible job, both with new cases and getting out those vaccines. We're joined now live by Tompkins County's Deputy Administrator, Amy Hendrick. Amy, great to see you. Thanks so much for joining us tonight.
Thank you.
We know that Tompkins County positivity rate has been right around 0.1%, almost zero, for weeks. That's so impressive. Well, how are you doing that?
Yeah, so a big part of it is we've continued to test throughout this pandemic, and we've partnered with all of our community members to make sure that we really are focused on our community health. And so as we ask our community to respond, they have been able to do that. So they continue to do that, and we continue to keep kind of that low percentage point. And we've done that throughout the entire pandemic. And a lot of that is also the availability of testing. Early on, our legislature decided that testing would be free for all Tompkins County residents. So people that are concerned can get tested at any point. And that commitment, along with the commitment of our 3 campuses in the county, really has allowed people to identify early and then become quarantined or isolated in case there is a chance of spreading the infection, which has really helped us keep it low.
Amy, before we get on to vaccinations, but what are you doing now to make sure you keep the numbers down? How do we keep the word out that testing is still necessary in a lot of occasions? So much focus is on vaccine right now, but you still need people to get tested, right?
Right. So that was something we discussed early on, is how do you balance both messages, getting a vaccine, but also continuing to do all those things we've been talking about since the beginning, washing your hands, covering your coughs and sneezes, all of those pieces, including getting vaccinated when it's available. A lot of time and energy is spent on that and ensuring that we continue to be really vigilant. And while many people are vaccinated, there are still a population that's not vaccinated. So we need to protect one another and continue to follow that same path that we started, 14 or 15 months ago.
We understand your vaccination rate is also impressive. Tell us about that, what the process looks like, and if you've had any issues and what you did to tackle them.
Sure. So right at the beginning of this, the testing as well as the vaccination is a partnership. And it's a strong partnership between Cuba Health Systems and us, us being Tompkins County Health Department and Tompkins County in general. And so when we started to talk about vaccination, we had already set up a large-scale sample site at the shops at Mall, and we decided to go ahead and start up a large-scale vaccine site. And so it looked a little different, as we had one of the largest vaccination sites prior to the state setting up some of their sites. So anytime we were able to get vaccine, we were vaccinating 800 to 1,000 people if we had that available. From there, we've continued to reach out into the rural networks and other places. We have started to go where people are. We also have educated our community a lot about how to get a vaccine and what it means to take the vaccine. There's a lot of hesitancy out there, and so we realized that we really needed to talk to people. Right now, we have a lot of community pods, and as the guidance changed and new people were added, we also launched a registry where people could sign up early on and let us know that they wanted vaccine. So when a clinic was available and they fit that category, we could directly communicate with them. We also translated a lot of things. We provided it in different languages and different ways for people to get that messaging. We worked with other community partners like the Human Services Coalition and 211 to ensure that people could call and ask questions about vaccinations or even schedule an appointment. So we really tried to make it as easy as possible for anyone to get a vaccine wherever they were.
Amy, is the push really right now, though, to get those reluctant or those hard-to-reach populations? I know rural communities sometimes have lower rates of vaccination than maybe more urban areas.
Right. So it is. Our push actually shifted a little with the Pfizer coming online for our 12 to 17-year-old population. And so currently, actually today, there's a clinic going on right now at one of our school districts for that population, and we're going to have a large event at the Mall Clinic this weekend. So we shifted away from our rural strategy, but we have had a rural strategy. We actually have had walk-in clinics in some of our rural neighborhoods. We partnered with a food pantry in one. We partnered with school districts. Anything to really get it there. The other thing we launched about a week and a half or 2 weeks ago is a business registry. So while Tompkins County is doing really well with our residents, we want to ensure that the people that are commuting into the county can also have the opportunity to get vaccinated. And I will say in some of those rural pods, I've heard people say, I didn't think I was going to do it, but it's here, it's easy. We've been using the Johnson & Johnson one-dose shot in a lot of those walk-in scenarios. So they really are more likely to get it.
Right, that seems to be really important, critical, just making it easy and accessible. Amy Hendricks from Tompkins County, so good to hear from you. Thank you so much for joining us tonight.